California did something no other state has been able to accomplish during the last few months of the pandemic: reach the CDC's moderate category for COVID transmission. And while we have since slipped back into the substantial category, the state still has the lowest number of new COVID cases in the U.S. per capita. ABC 10 News reporter Jared Aarons takes an in-depth look at how California has been able to lead the way in fighting the pandemic.
The map on October 4th showed California alone in yellow, the CDC's moderate category for COVID transmission. That's the second lowest category on the CDC's four-tier system to track the spread of COVID-19. According to CDC data, California was at just about 41 cases for every 100,000 people on a 7-day average. Experts I spoke with say it's a combination of high vaccination rates, strict public health mandates, and our own personal everyday behavior, keeping California's numbers down even as the rest of the country goes up.
I think the first is maybe the one that's most obvious and the big ticket item, which are the high rates of vaccination that we've seen in California.
Dr. Eyal Oren is the interim director of SDSU's School of Public Health. He says it's not just the number of vaccinations, but the way the state has emphasized vaccines that's kept COVID at bay.
It's not just about the vaccination statistic, it's also how you get there and what you do to, I guess, enforce or follow up.
Right now, California has 59.5% of its total population fully vaccinated. That's behind 14 other states and the District of Columbia. But Oren says a deeper look at the data shows why California's case rate is lower than all of them. He points to California's major population centers, where LA is at 69%, San Diego at 79%, San Francisco at 75% for vaccines. Oren says higher vaccine rates in more populated, denser cities helps the entire state slow the spread, even as smaller counties lag in their vaccination efforts.
We know this is a transmissible disease, easily transmissible. So wherever you have greater cores of density of people, you're also more likely to have potential for transmission.
Meanwhile, Oren says recent statewide vaccine mandates for healthcare workers, public employees, teachers and faculty at schools, and soon students push vaccine rates higher and transmission rates lower. The state also has rules requiring vaccines or negative tests at so-called mega events of more than 1,000 people inside or 10,000 people outside. And renewed indoor mask requirements over the summer reminded people the pandemic wasn't over, just as the Delta variant surged.
I personally saw how that changed the conversation and people sort of thought about those indoor environments. There was a quick shift.
Meanwhile, California's geography and weather also play a role, allowing people to spend more time outside, socially distanced and safe.
We know that being outside, allows for a greater dispersal of any kind of viral particles. We know that ultraviolet light kills many viruses, bacteria, including COVID.
Even though the latest map shows California has since slipped back into the orange or substantial category for spread, Oren says all the things that we've been doing and will continue to do should be enough to slow transmission. He warns, though, now is not the time to let up. Jared Aarons, ABC 10 News.
If you would like to look at the data from both the CDC and the state of California, we have put links for you on our website, 10news.com.